work with people who've got a mental health problem and often quite complicated situations. We call that complex needs. And our tagline is flexible support in complex situations. Elmwell works with about 200 people every year. We have a team of support workers, and what they do is go out and visit people. It might be in their home, it might be a place that they're comfortable, it might be a walk around the park even. So we'll go and meet people where they're at, talk to them about their issues and help them, support them to try and resolve some of their difficulties.
Response is an organisation. We're based mainly in Oxfordshire, and we provide housing, care and support to people with mental health problems and complex needs. We provide hope for those individuals because we specialise in housing individuals who have struggled maybe to make that transition from hospital into the community, or for whom community living is difficult.
We work with people with mental health problems to help them live successfully and independently in the community. We're very passionate about trying to make sure the service is available, and so we try and get people towards sort of closure and being independent as soon as we can, and then people will away back to the service if they need that later on.
We work with about 1,000 people a year across Oxfordshire, and we have two main services, our recovery service and our coaching service, which could be serving food in our cafes and making things to sell in our shops through woodwork and gardening and crafts. And through that, people find a renewed sense of meaning after being ill.
Bring to that partnership our expertise of running our housing projects, of our wellbeing services, our links with the Talking Space Psychological Therapy Service, which we will need to link with for this service. So we bring our expertise of running those services, but I think more than that, or as well as that, we bring our passion and our commitment and our determination that we need to provide the best possible services for people with mental health problems. We really do want to make sure that anyone with a mental health problem has somewhere to turn for advice and support.
So what Oxford Health does already is provide a wide range of care and interventions for people experiencing mental health difficulties within Oxfordshire. We'll continue to do those things, and that ranges from working with people in the community in their own homes for acutely unwell to working with people in our inpatient wards who need that level of care.
The partnership is 6 mental health organisations in Oxfordshire coming together to work together and learn from each other to provide better services.
It's about wrapping services around individuals' needs rather than expecting the individual to meet services needs.
It's an opportunity for us to involve people who use services more in those services.
And of course we've always worked together, we've always done our best, but what's going to be different I think in the partnership is a much closer working, a much better understanding of what the different partners are bringing.
And the partner organisations, staff from those organisations have actually been embedded into our adult mental health teams, which means that people using those services have rapid access to those skills.
We work together to make things the best that we can with the resources we've got available.
It moves towards thinking about outcomes for the individual. So rather than looking at how many people we see each week or how quickly we discharge people from services, it's about looking at the outcomes that are important to the individual and measuring those.
New developments like the Recovery College are going to offer something different that people haven't seen before. So we're really excited about it.